All right, Dr. Ahmad, I appreciate your time, man. I know you're kind of in the same boat as everyone else, but I definitely want to, just thank you for your services and everything you're doing during this time frame for the community.
Thank you.
So we're just going to go through really some questions to really help other independent doctors and physicians in the community to see what you're doing within your operations, with your team, with your marketing, with your mindset, to really just help encourage others. So I'm just going to open it up and really let you introduce yourself and what you do here in Charlotte, and then we'll just go through all the questions that we have for this call.
Okay. My name is Ahmad. I'm a physiatrist by training. I practice independently here in South Charlotte. I have my own private practice. We primarily focus on interventional pain management here. I'm not necessarily in a hospital setting. It's a 100% outpatient setting. So I'm not in the critical care or the front lines. So for us, it's a different take on this whole pandemic and what we can do. Our part, really, from what I focus on, is kind of helping the public, patients, and preventing anybody really from even needing to go to the hospital, and try and take care of this stuff as much as we can on an outpatient basis.
Yeah, that's awesome. So for you, how has COVID-19 impacted your practice at this point?
I mean, it's really multifactorial, from a business standpoint, it's decreased patient volume, is decreased. It's obviously going to decrease revenue for the practice. We've had a transition to primarily telemedicine. We're changing staff hours, lessening staff hours, trying to keep all the employees on, but it's just, I feel like every day we're making changes to kind of adapt to the situation.
Yeah,
It's tough, to be honest with you.
for sure. And I think every other independent doctor is feeling the same as well. But I think what you're doing is taking the right measures to keep everyone safe. For your current office, you have limited hours. How are you keeping things safe? How are you taking those measures, those extended measures to keep your practice safe and your team?
Before this virus, I do a lot of procedures in the office. So just naturally, we do a lot of disinfecting in between patients, a lot of the normal things you would see in any medical office, washing hands frequently, sanitizing everything, etc. I think now everything's just kind of is stepped up, right? Like we're pre-screening the patients over the phone, making sure they've had no exposure or not displaying any sort of symptoms. We're making sure we're disinfecting the waiting room and all the doors, the high traffic areas, at least every hour. We're minimizing the number of patients and actually in the office. Like I said, we primarily moved to a telehealth setting. There are patients that do need to be seen in person because a huge lack in telehealth is you can't do a physical exam. And physical exams very important. So those patients we bring in, we have them spaced out so we don't have patients waiting in the waiting room. We just bring them back immediately. We're limiting it to just one family member. There's a lot of things that we're trying to do on our best to try to keep that social distancing, limit that exposure risk.
No, that's awesome. This is going to change, your practice and everyone that practices in the pain management industry forever. But I think what you're doing, you're definitely taking the right measures. I guess right now with what you're changing in your practice, what's your current mindset? Like, how do you change your perspective and mindset? And then the second part of that question is, how do you continue to, hone that leadership during this uncertain time?
I think that there's two ways that I've come about this. One is the way I deal with my patients, and two is how I deal with my staff. In regards to patients, we've been very communicative with them. we're sending emails, sending phone calls, making sure everybody has their appointments set up. Everybody knows that we haven't essentially forgotten about them, right? That we're doing the best we can to keep in touch, and that whatever needs they have, we're able to address them however it is, be it telehealth or in person.
Right.
I've been very open and communicated with my staff. Obviously everybody's scared of their jobs and lack of hours. There's been a lack of volume. I'm just being open with them, letting them know that that I'm going to do the best all I can do as a physician, two as their boss, or even as a small business owner, to
Right.
keep them employed. So they get paid and can take, money home to their family, their kids and stuff,
Right.
etc. It's just, it's tough, man. It really is. It's definitely, it's stressful, I would say. Making sure staff is safe, patients are safe. We have all the appropriate equipment,
Right.
Personal equipment. I constantly, make sure that even from the staff end, we're limiting our exposure, because even if a staff member wants to go out to the grocery store or, whatever, that, there's a risk associated with all of that. So,
Sure.
telling my staff to even on their personal time to limit their exposure, because I can't have anything brought back to the office for patient safety reasons and stuff like that. So it's a lot of things going on,
Yeah, for sure. So yeah, definitely you touched on, the certainty that you're building with, your mindset and your team, but then also, how you're taking those measures for everyone. So I think that's so important with, how we are addressing this situation with, how you practice your business, especially moving into telehealth. You're offering a new solution for patients who still need assistance and need your help.
Right.
I guess for you, is there anything in your business right now you're like now that you have a little bit of downtime and you're not, seeing a full house of patients, that you're like, when you look back in hindsight, you're like, now I have the time to make this procedure or this operational process more efficient? Is there that one thing that you would encourage other independent physicians to say, okay, this is something that's, been affecting my business. I haven't had the time to look at it, but now it's a really good time to, try to make it more efficient with how we operate.
Yeah. The biggest change for us has really been this telehealth.
Yeah.
To be genuinely honest with you, it's probably something I would never even considered out or even looked at until this happened, right? Mainly because with my specialty, it's physical exam is so important, right? If somebody comes in with knee pain, I have to be able to move that knee around, check its stability, its strength, etc., range of motion, etc. You can't do that over telehealth. But I think the benefit of telehealth is the other things. Like, there's patients sometimes they have difficulty coming to see me because maybe they live far, or maybe they're currently sick, or maybe they're out of town, or whatever it is, right? This is it's a great tool to still be able to have access to a lot more patients, right? I've even had patients that were seeing me in nursing homes and stuff, that would have to get transportation set up with a nursing home to come and see me, right? This is a great option that now they can kind of see me through telehealth. For example, earlier, a patient of mine is worried that next month she won't be able to follow up with me because she's going to Kentucky to visit her brother, who's actually end-stage cancer on hospice care. And I told her, like, we have this option of telehealth, we still keep in touch through this. So I think this is something definitely new that I wouldn't have done. Outside of this, I think I'm kind of looking at my marketing all over again, right? The stuff that I've been doing with you guys, the digital marketing, my website, checking those things out that maybe I didn't have time to sit down and look over yet. I think that things are different. Volume is low, revenue is potentially going to be low, but we're not at a standstill, right? I feel like there's still ways that I can improve the business, make things more efficient. Even just from a physical standpoint within the office, we're doing things with just making things within the office a little bit more efficient.
Yeah, for sure. And I think it's key that you are, because a lot of doctors right now, they can't offer telehealth, or they're They maybe can, but their mindset right now is just to close the doors completely and kind of
Yeah.
wait it out. And I think you're taking the next best step for your practice, not just for now, but for the future, because that means there's opportunities for you to touch people not just around Charlotte, but nationwide as well, with telehealth. And it's a great transitioning into your marketing game plan. So you talked about how telehealth is helped you really transition or think differently about how you will market your business.
Yeah.
And I know what we're doing, from MedRank Interactive side of things is we're helping you guys with a lot of new content, especially for regenerative medicine, PRP, and stem cell, because those are big treatment
Right.
processes for procedures for you. So I guess from a telehealth standpoint, was it hard in your mindset to set that all up? Because I'm sure there's other doctors who are like, maybe I should do that, but they don't. Maybe they think it's too complex. What's your thought process on getting that set up and adding value to the community with virtual consultations?
I think that initially it is kind of intimidating because you're not really sure of how easy or how easy it will be for the patients to kind of set things up.
Yeah.
I was actually pleasantly surprised of how simple it really was, right?
Right.
There's a lot of software out there. We're using one specific software that's called Doxy.me that is HIPAA compliant, it's secure. So those are things that are important, right? From a patient standpoint, it's very easy. They can just kind of click on a link and they're up and seeing us.
Looks like we lost Dr. Ahmad. Hopefully he'll join us here shortly. But while we wait, I think, for a lot of independent physicians who are in the same boat, there's definitely, there's obviously fear. There's a lot of uncertainty with, the pandemic 19 kind of spreading rapidly. But I think there's opportunities from a digital standpoint. Here he comes. To be able to showcase your, what you can offer to the community, even if you can't see them directly. So it's always a good idea to think ahead of what you should be doing now because you have downtime. All right, Dr. Ma, we got you back. I was just kind of giving a brief of our transition to marketing.
I'm sorry. Say that again. I lost you there for a second.
I was just talking about our transition to the digital marketing question. But yeah, go ahead with kind of, your thoughts on, running telehealth and how you were able to set that up.
Oh, yeah. I mean, I think like I was getting to, just the process of it was actually a lot easier than I thought it was going to be. How we ended up doing was we contacted all of our patients beforehand via phone,
Okay.
Making sure that they had a device that was compatible to do telehealth, a laptop, an iPad, iPhone, whatever type of phone. And then we did a test run. Like my staff would do a test run with them the day before their appointment to make sure everything was up and running and they were comfortable doing it. And the day of the appointment, everything's going great right now, to be honest with you.
That's awesome. That's really good to hear. And I think it's also encouraging to others who have thought about it or are going through the process right now. So it's glad to hear that you have it up and running.
Yeah.
So real quick, before we transition to the next question, just kind of want to show some marketing results based on our March report. Obviously, there's still a lot of good insights here, and a lot of your metrics are trending in the right direction. Obviously, I'm not going to go through this whole report, but just what I like to see is, even the trend is still going in the right direction. Obviously, there's going to be a slight dip based on, what our current situation is, but the traffic is still trending in the right direction. Your actually phone calls are going up more because people have more time to search online. What was interesting too is like even since now, like a lot of other physiatrists or your competitors may stop their marketing all completely. So your mindset right now is how can I capture that market while everyone else is kind of at a standstill and saying, hey, we're going to pause our future investment. I think your mindset right now is, hey, how can I capture this market and be competitive? Right. So like when I look at like just, some of the keywords are still moving up, and also we're running Google ads for telehealth as well. So what we're going to see with Google ads is, a lot of the cost per click is going to go down drastically because there's not going to be a lot of competition.
Right.
That'll be a huge opportunity. And then from an SEO standpoint, where people are trying to rank in Google for their targeted keywords for lead acquisition, I think there's a lot of opportunity to capture higher rankings much faster with Google's algorithm. So it's just cool to see, because like even in this graph here, like, we've been working together for 2 years now, and trend, all this trend says is, brand new website when you transition, and zero keywords ranking in Google. Now you have over 500. So it's just awesome to see that, your growth mindset is consistent. And I think when this is all said and done, you'll come out on the right side of that process and the strategies that we're helping you execute. I guess one final question for you is, like, what is exciting to you about, even though we're, this is an uncertain time, and it is scary, and a lot of people have a lot of fear, and they're afraid of what may happen or what is currently happening. But what can you say that currently you're excited about coming out of COVID-19 after everything is kind of resolved?
I think just as a society in general, we've faced other major issues, right? I mean, everybody's fully aware of things like 9/11 and other like major instances that happened. And I think one great thing as Americans, just in general, we always tend to come together, right? Yeah. And I see that now, even with my patients, my staff, is kind of, everybody understands the situation we're in, the social distancing and whatever else is, and everybody's taking that into consideration. But everybody's asking, the first thing they're asking with everybody is, hey, how are you? How's your family? Yeah. Right? How's your family doing? How's the wife? How are the kids? And I think it's reciprocal, right? Like doing that. So I think that it's brought out in so many instances, bring out the best in a lot of people, right?
Yeah, for sure.
People donating items, donating their time, donating food, whatever it is, right? I think I'm excited for things to get back to normal. Yeah. I think hopefully sooner rather than later, and I think it will. I was very excited in the growth trajectory that the practice was taking. Yeah. And I really hope that and I really do feel like this is just kind of a little hiccup on that, on that growth, and things will go back normal, and we will be able to get back there. I think that's what I'm excited about, what my staff is excited about. And really, I mentioned telehealth a lot, and it's a great tool. It's been very helpful for us in this time. But there's a totally different type of sense of feeling when you're taking care of somebody face to face, right? When you're providing people, when you're meeting people face to face in the office. And I think that's another thing that I'm kind of excited to get back to normal, right?
Right. Now that's awesome. That's awesome. And I feel like, again, it's going to be, it's a time frame where we're, at a standstill, so to speak, and businesses may get slow, but I think after this, it's a great opportunity to capture a lot of those patients or potential opportunities that you may not have been in front of by continually staying or having the right mindset, like you have with the leadership that you're showcasing with your team, but also continually evolving with telehealth. Because, like you'd say, 4 months ago, were you thinking about telehealth? Not at all, right? So, well, man, hey, I appreciate your time, Dr. Ahmad. Do you have any final words of encouragement or thoughts before you end?
I think that in regards from a business standpoint, just stay the course. Everything will go back to normal. We've gotten through other things in the past. We'll get through this, and just know that there is a light at the end of the tunnel.
Right. Yeah, I appreciate those thoughts, and I think this is going to be so valuable to the Charlotte community, also to peers and colleagues. And I appreciate the time, and thanks again. And so Dr. Ahmad with Advanced Sports Spine and Lamar's MedRank. Have a good day, Dr. Ahmad.
All right, you too.
Thank you.